Hey guys, it's me, Brian the Birth Guy. You're here at my vlog again. I'm so glad you are. But this is a special one, because if you notice, it's in a different spot than I usually do this in. So check this out. The reason being is, I've got someone very special sitting next to me who I love working with. This is one of my favorite OBGYNs in the world, and you're gonna figure that out for yourself as to why that reason is in just a minute. So, I'm a doula and a lactation counselor. Why don't you tell them what a doula does?
A doula is instrumental for education and support before delivery, during delivery, and for some doulas even after delivery.
I love it. And you're an OBGYN.
Tell us what an OBGYN is.
An OBGYN, you guys, this is the doctor that should be giving you the best care you possibly can get and listening to you, hearing what your needs and your desires are. This is what sets apart a good OBGYN from just the normal old school OBGYNs. This is a changing time for birth. Everything is becoming so much cooler, and people are really seeing that they can have birth the way they want it. And that means if you want an epidural, get one. That means if you don't want to talk about anything, don't talk about anything. But some people do want to communicate with their doctor, and that's called collaborative care. As an OBGYN, Dr. Morales goes and she will see you through the whole pregnancy. She will give you advice on nutrition, on your health, on doing the best things to make your birth and your baby the healthiest, happiest thing that could ever happen, right? That's her job, to try to do that. She'll be there at the delivery with you. She will be following you, and she will help you deliver your baby safely and in a great spot. So what we're gonna talk about today is something that's really cool. Everybody looks for collaborative care, and all they find is collaborative care articles about midwives and doctors, or psychotherapists and doctors, or like, you know, if someone has a pre-existing condition, their primary doctor and the OBGYN. That's all fine and dandy, but there's a whole new type of collaborative care that we're really into getting people to know about. This collaborative care is between the patient, the OBGYN, or the midwife, and the nurses, and maybe even little old me or any doula that you got working with you, which is kind of cool. How would you best say, Kelly, that the overall collaborative care should begin?
Well, it begins in bringing up the questions. It begins with communication with your doctor, with your midwife, with your provider, saying these are things that are important to me. These are things that I would like to see at my delivery. These are, you know, concerns that I have about how the process is going to work. So bringing up with your provider a birth plan, coming up with a plan together of these are the things that need to happen. And then getting educated on those, finding out maybe reasons behind certain interventions,
Sure,
or why we do things a certain way, so that you're talking with your OB, you're talking with your provider about those important aspects.
I'm going to add something. When you're doing collaborative care and you do have other birth workers beside your OBGYN or your midwife, if you've got a doula or childbirth educators, it is super important, you guys, that you look for some red flags, which would be negative things about doctors, negative things about the whole overall procedure of hospital birth or of your birth center birth, whatever. You need to make sure you're getting positive, good information that you can assess and make sure it's what you want. Do you agree with that?
Absolutely.
Because there's a lot of negativity out there. Nobody needs that when you're pregnant. So with collaborative care, and Dr. Morales knows this because you trained all over the world, right? You were in Germany, you were stationed, she was military. How did that affect your perspective into practicing this way?
Well, I think it exposed me to a bunch of different ways to address pregnancy in general and how to address delivery. I worked with midwives in the military. I saw that there was a lot of different ways to achieve a healthy delivery and a happy delivery as well. So I think that all contributed.
And I have to tell you, I've never been to a birth with this woman that has not been anything but fantastic. Great job. You know, she has some great tricks, and so I know we're talking about collaborative care, but I want you guys to know that what you want, you can get, or get close to it. You have to be open to understand that we weren't all supposed to survive birth. In ecology, there's something called the carrying capacity, and everybody that's in this ecosystem can only go so far with that population of whatever it is, whether it's a bird, a bug, a species of grass, or whatever. So nonetheless, you really have to understand that a lot of people shouldn't have survived their birth, or the baby shouldn't have survived, but we have interventions that can help that. I find that understanding the interventions and not fearing them, but understanding them, and when the proper use is there, that really is a saving factor. But you have to be able to ask some questions. What do you think your clients should ask you?
Well, I think it's important not to come with this feeling of it's us against them or them against us, or that birth has to be this scary, medicated, full of terror sort of event. I mean, it can be a beautiful thing, and bringing up those things with your doctor, midwife, incredibly important.
Totally. I always tell people, and we've talked about this before, that you have to ask certain questions without being combative. If you're really worried about something, say you're in the hospital, a nurse comes in with a bag she hangs out or something, you're not sure what's going on. She's like, oh, well, we just want to do this. You can ask a question if you're scared. You can ask 3 that are very important. Is something medically wrong with mom? Is something medically wrong with the baby? And what are our options? And a lot of times you'll find you do have some options. And the old perspective was, oh, she's not moving along. Say you're stuck in your dilation, okay? And maybe you're at a 6 for 2 or 3 hours. And like, well, we just want to help you out a little bit. Well, mom can ask. For some moms, they might hear that as I'm failing or I'm not doing my job, right? So they may want to try something different just to give it a whirl. And you go, you know what? It's safe for another couple hours for you to give it a shot if you've got the energy to do it. If not, we'd love to help you out this way. Or something like that. And these are things that I'm typically hearing in the hospital now, which is great, because I hear so many people say so many negative things, and it doesn't have to be a negative experience. Hospital birth, home birth, birth center birth, whatevs, right? It can all go well. And just you have to practice things safely, and safety comes with knowledge. You agree with that?
Big part is probably our explanations of things as well.
Yes.
So if I do notice that somebody seems to be getting stuck in labor, I'm not just going to call the nurse and tell her, well, turn up the Pitocin, we got to do this, we have to do that. I need to have that conversation with my patient and be able to explain, this is kind of what I'm seeing. Again, this is either something wrong with mom, something wrong with baby, or here are all of the different options. What would you like to do? So
I love that. And if you're that type of patient that wants that type of care where you can communicate with your doctor, you have to start early on, because you may have an OBGYN that is stuck in the way that they practiced previously, which may not be this new contemporary type of practicing, which means they may not want to listen to you or say, no, I don't do that, or I won't do delayed cord clamping, or things like that. This is important that you find this out early on, because then you can either choose to stick with that doctor and you make an agreement with yourself that you won't have regrets if it doesn't go the way you want it, or you find a physician that will listen to you. And there are physicians out there like that, and that's why you're so special in our community, especially. If we can clone you and put you all over the place, that'd be awesome. So, I said something on one of our podcasts, as a matter of fact, and speaking of which, you've got to listen to the podcast with Dr. Morales on it. It's episode, I think it's 2 or 3, I can't remember which episode it is, but you can find it. And you can find it on iTunes, on Stitcher, on Blueberry, or just on our rockingdads.com site, which you're here, so take a look. She's worth the listen. She is our most listened to podcast, right next to Adam Busby, and he's famous. So you're doing something right. And let me you're pretty awesome. So let me tell you something, you guys. Really seek out collaborative care. Really seek out talking. And we discussed something one time on the podcast, on a different podcast that you weren't on. I said I would love a birth center with you, my friend David Goslin, who's an OBGYN in Santa Monica, and Dr. Stu, who's an OBGYN in California. He only does home births. He's one of my mentors. And let me tell you something. That would be the dream center. But anyway, okay, guys, this has been awesome. Is there anything you want to add to let these guys know?
Talk with your doctor. Talk with your midwife.
Communication.
Communicate. You've got to communicate. Let them know your desires.
You got to communicate to collaborate. So check this out, guys. Dr. Morales, tell them where they can find you on Facebook.
So Facebook is Kelly Morales, MD, OBGYN, and online at www.kellymoralesobgyn.com.
Boom. Go check her out and listen to that podcast. You guys, thanks again for watching, and we'll have another great vlog for you. This time I didn't read you a Don Miguel Ruiz card, but I promise you I'll give you 2 next time. Or maybe you guys could say, please don't read another one. But listen, guys, I hope you guys have a great time out there doing what you're doing, and get the information you need, get the education you need. You know where to find us, and we'd love to help you.